Okay.
Thank you very much, Karina. So, hello everyone. Hello to all the students around the world in this winter school on tropical disease founded by the Botucatu School of Medicine, UNESP. My name is Alexandre Naime Barbosa. I am a professor of infectious disease in this medical school here at UNESP. And also, I am an infectious disease medical doctor that works at 20 years in the field of the infectious disease with a lot of different pathologies. Nowadays, I am also the vice president of the Brazilian Society of Infectious Disease. Well, the main objective, the main goal of our course is to give you a little brief of the main infectious disease problem here in Brazil, trying to put you in our reality, because unfortunately, because the pandemic, you can't be here. But I think with some lectures and mainly with discussion after the lecture, we can provide a good overview about the main topics that affect infectious disease in Brazil. So I will start with my presentation, maybe 30 minutes of a little overview of the infectious disease scenario in Brazil. And after, we'll have about 15 to 20 minutes for discussion. So the title of this presentation is Overview of the Infectious Disease in Brazil. This lecture is prepared for the Winter School on Tropical Disease of the Botucatu School of Medicine 2022. So when we look at the past scenario of the infectious disease, for example, more than 1 century ago, we can see in this nice paper published on the New England Journal of Medicine in 2012 that the main cause of death was infectious disease problem, like pneumonia, tuberculosis, and diarrhea and diphtheria that that accumulate the sum of more than a half of the death in the beginning of the 19th century. So the the, the infectious disease were a very big problem about a century or a half a century ago. And here we can see like this problem were less problematic about the last century, mainly because we discover two tools, two main strategies to fight against the infectious disease. Uh, the first one was the discovery of the first antibiotics, for example, to treat tuberculosis, and after the vaccine that was expanded for many countries. So a lot of disease that caused more than 50% of death in the past declined in the middle of the last century. Uh, one, uh, one point that is very curious is that our hospital, this is an old photo, old picture our hospital here at Putkatu. Our hospital was made for receive tuberculosis patient, and it was completely anachronic nowadays because tuberculosis is curable and preventable, and this is a nice example how the humanity could manage better the problem of the infectious disease. But we have a lot of points to observe when you talk about infectious disease. We know that there is some disease that can emerge, uh, like for example, we can talk about the monkeypox scenarios, or diseases that are endemic, like for example, influenza, and the road to fight against infectious disease is closely related to epidemiological transition. And at the middle, to the in the years of the 60s, a lot of people think that infectious disease was a solved problem. This is a this is a period of the McFarland Burnett in 1962, and he received the Nobel Prize. And at that time, he think that one the most important evolution in history is the elimination of the infectious disease, and other people think like him, saying that the infectious disease was a problem solved and the major infection will have disappeared in the next years. But we know that unfortunately all these people uh, were wrong, and we have a lot of infectious disease problem nowadays, like for example COVID-19 and monkeypox and HIV, and a lot of other disease like respiratory infection, HIV/AIDS, diarrhea, or malaria, sexual transmitted disease, meningitis, hepatitis B and C, and a lot of other disease that we will try to cover in the next lecture. So the the total of that that in the end in the beginning of the last century was 50% caused by infectious disease. Nowadays is about 20 to 30%. So 1/3 of all the mortality in the world was caused by the infectious disease. And this problem is decreasing, but we know that it's not completely solved, like you can see in this slide. And in the last years, the infectious disease problem is beginning in more evidence for the epidemic of the influenza, of or maybe for other reemergence of tropical disease like monkeypox. And when you look to the world scenario, we can see very clear that countries that have less income and less money to invest in health pay a very high bill in terms of mortality. Like for example, the Africa above the Sahara Desert, or countries that is in the Asia, maybe the Southeast Asia, or maybe countries in the South America. It's like I said to you, the infectious disease problem is the strongest in the in countries that has that have a bad uh, a bad income in terms of money. And when we divide the disease to the money, to the population, we can see in the upper middle income countries, the infectious disease is more infrequent, but it's becoming more frequent when we look at the lower middle income countries or maybe the low income countries. You can see here a lot of infectious disease that cause a lot of deaths. So this is a problem about the distribution of the money also. Brazil is not so poor like many other countries in Africa, but the balance, the distribution of the money is not so good. So we have a bad distribution, and infectious disease is more frequent in this type of country, like you can see here in this other slide that show the same thing, the bad distribution of the research. So Brazil is in the middle of a long list of countries that invest uh, more money in the health. Uh, Besides the fact I told you that we have a bad distribution of money, we have here in Brazil a very strong public health system that provide uh, almost everything to all the population completely free of, of charge. So uh, Brazil invests a lot of money in the health public system, and it balance a little bit better the situation in terms of the health. So we see here in Brazil that we are declining a lot of problems related to infectious disease, like for example tuberculosis and HIV/AIDS, and some problems like malaria and other tropical disease like Chagas disease and diarrhea. But the problem is here. It's not completely solved. We are very far from that, but we are declining this rate uh, uh, and we see uh, 2 or 3 decades ago. Uh, but there are some diseases that are very difficult to manage because mainly the social distribution of the research. We have a lot of patients, like for example, Chagas disease, leishmaniasis, schistosomonia, cysticercosis, and other very tropical disease or dengue, trachoma, and leprosy, and other tropical disease is very concentrated here in Brazil. And when we look specifically to the rate of deaths in Brazil, we can see here lower respiratory tract in the third place, HIV/AIDS, like on the most important cause of death. But there are some amenity, like I said to you, we have a unified health system called SUS. It's a universal system of health that can give all the population universal access. Is very decentralized system, and the focus is on the primary care, and there is some social participation in terms of the administration of uh, uh, this health system. And like I showed to you, the bad distribution of the money. We have a bad distribution of the doctors and also a bad distribution in infectious disease specialists like me. The majority of the infectious disease medical doctors are concentrated in the more rich, more developed states of Brazil, like São Paulo, Minas Gerais, Rio de Janeiro, Paraná, and Rio Grande do Sul, and states that are very poor and that concentrated a lot of patients with neglected infectious disease like Chagas disease or dengue or malaria has a few infectious disease medical doctors to treat, to recognize, and to manage this patient. And this map is very similar to the distribution of the other medical specialty, including general medical practitioner. So there, this is a other example like the distribution of money concentrated also the doctors and promote accelerated process of bad distribution of the healthcare. And the main population in Brazil is in the big cities. 84 84% of the total Brazilian people live in urban areas, and they have a lot of migratory fluxes, migratory roads that is going to the most biggest city. And because we can improve a little bit in terms of control the mortality in the diarrhea disease, tuberculosis, respiratory tract infection, we can see that the life expectancy in Brazil increased uh, of 58 years in 1960 to 75 years nowadays. It's a good increase, but we can do better. Our age pyramid is changing to oldest participation of the majority of patients, and we can see here that the HIV components are increasing too, but we we know that we increase more quickly. And when we see the mortality of the children under 5 years, we are going to a better position, but we can do better because the other problem that is related to the bad distribution of money is the water and the sewage treatment. Only 85% of the total population in Brazil receive treatment, receive water with good quality that was treated against the infectious disease pathogens, infectious disease uh, microbes that can develop, for example, diarrhea. And treatment of the sewage, only 40%. If you look at the north region, only less than 15% of the people receive sewage treatment. So there is a lot of problem related to water disease and insect-borne diseases that are transmitted by mosquito, for example, dengue and yellow fever, chikungunya, and Zika. And we have a very long road to solve this problem. And I will talk to you a specific letter about our universal health system, but this is the biggest tool, the biggest strategy that we have here, trying to solve or to reduce the disparity of the money distribution. Uh, so this is a nice paper that I will post to you read. After this lecture, it was published in Lancet in 2019 that explain a little bit about how our public health system works and improve the health problem. But it, you can imagine that the health problem is not only a question that talk in to the medical professional. We have to increase investment on the education and support the basic needs of the people, improve the supply, like I show you, better treatment of the water and the sewage, and trying to put down the level of birth deaths and illiteracy, and also a problem that is becoming more uh, more severe, more strongest here now. But I think in now the world is a big concern. It's about the vaccine efficiency, the vaccine coverage, because the fake news and other problems, we we are seeing now a decreased rate of vaccination. But we have to put in mind that Brazil in the past has had a very nice vaccine coverage. For example, for polymyelitis, we have more than 97% of vaccine coverage is declined because the anti-vaccine uh, propaganda. So basically, we have a lot of social inequalities and other intrinsically vulnerability to infectious disease. So governmental problems is very important to decrease the impact of the infectious disease, and we have several challenges to try to benefit everyone in terms of one health approach. Thank you very much for the attention. I will close my presentation, and I am here to hear your question, your comments about this topic. You can talk on the microphone or send message in the chat. Please, Joshua, can you introduce yourself and speak your question, please?
Uh, Good afternoon, Professor Barbosa. I am Joshua Koje. I am a student at UCH SEO, Carina Herrera in Spain, Valencia. And I have a question. My question is, during your wonderful presentation, thank you for that. You explained that most of the health professionals, especially the immunologists, are specialized in living in the richer areas of the city. Are there any incentives for them to move out to the not as wealthy or poorer areas of the country?
Yeah, Joshua, thank you very much for your question. Uh, we have some incentives to put mainly primary care doctors in the poorest area of Brazil, mainly in the north and northeast region. But even when you pay a lot of money, like for example, uh, $10,000 a month, the medical doctors don't want to stay a long time, maybe 3 or 4 months, because this part of the Brazil and I think it's the same in other parts of the world, has a lot of benefits like infrastructure, roads, and airports, and even amenities like malls. And what we see is the incentive, the good payment, only work for a little time, 3, 6 months, and the doctors go away after this time, what is not good because you cannot do a link between the medical doctor and the population, and uh, the strategy that we are trying to do now is to construct a career, a long career. So you start, like for example, at the $7,000 US dollar a month. When you stay more than 1 year, your your salary, your money is going up. Trying to fixate these people in this area
Yeah.
because uh, we don't have other attractors or incentives. Uh, One thing
Okay.
that works a little better is to give in the medical school a percentual of quote. So
Okay.
for people that not study in particular school has a direct way
Okay.
to enter in the medical school. Here at UNESCO, I think 50%, a half, a half
Wow.
of all the students is enter in this system. Uh, and these students is more frequently going back
Mm-hmm.
to their communities, and
Mm-hmm.
they they have, for example, family or more more incentive by himself, themselves to stay in the poor communities.
Exactly. I agree with that incentive because it's taking the people, making it better, and bringing them back. Than bringing foreign people with their own cultures. They may not like the traditions. They may not like it's a town. It's not where I'm from. I think it's a much better incentive. Thank you for your answer, Professor.
Thank you for a question. So, Karina, I think we
Yes.
don't we don't have more questions.
No more questions?
Hi, I just have a comment.
Please.
Just like I have just some technical difficulties, so I cannot present myself. I'm Jolux from Mexico City. I just see a lot of similarities between our health systems, and I'm really excited to continue with this because we can see through each other's healthcare systems, and that's it.
Thank you very much for your comments.
So, okay, if we don't have more questions, I think we can finish. And tomorrow, Professor, is it you who is going to give the lecture?
Yeah, all the week
All
is
the week, okay.
yeah.
So you,
Tomorrow we will talk about the arbovirosis in Brazil.
yes.
Okay,
Mm-hmm.
starting at 11:30. I will try to give a little brief about dengue, Zika, chikungunya, and yellow fever. We are now in a new epidemic of dengue in Brazil. So I will show some specific issues that we have with dengue here and talk a little bit about the past and past epidemic about Zika, chikungunya, and yellow fever here. Okay?
Good. So we see you tomorrow at 11:30, and I kindly ask you to fill out the attendance form I put in the chat so that we can prepare your certificates, okay, based on your participation. So thank you all. Thank you, Professor, for the excellent lecture, and see you all tomorrow. Any questions, you can also write to us, right? I'll type in our email here. We can send your questions to Professor Alexandre as well. Okay?
Perfect. Bye-bye, people. See you tomorrow.
Thank you so much.
Thank you.
Thank you. See you tomorrow.
Thank you. See you
Bye.
tomorrow.